Well, hi everyone. I hope you're all keeping well and safe. And so, my name is Mr. Neel Raithantha. I'm a consultant audiologist, and an audiologist is a clinical healthcare professional who specialises in the diagnosis, treatment, and rehabilitation of people suffering from both hearing loss and balance disorders. I'm very humbled and honoured to be able to give you this talk today on hearing loss and diabetes. So I know time is precious, there's a lot to go through, so if everyone's got their chai, let's begin the chat. Before I do that, I just have to declare all of my potential conflicts of interest. I think that's the right thing to do. So I'm the director of two companies, the Hear Clinic and Clearwax. They're both private companies where I actually charge for my services, and these services range from the prescription and fitting of hearing aids, the manufacture and supply of ear defenders, and also swim moles. As an audiologist, I also perform and train others to perform clinical ear care, which involves earwax removal. And I also run a national web portal designed for patients to find their nearest ear expert and specialist, and I charge these ear specialists a fee to register and advertise their services on this portal. Okay, so how do we hear? How do our ears work? So the hearing pathway can be divided into three distinct but connected regions, and these are the outer ear, the middle ear, and the inner ear. So on the right of screen, you have an image, a cross-sectional image of the ear. And what I've done, I've shaded each of these three regions in different colors. So the outer ear has a green background, the middle ear has an orange background, and the inner ear has a blue background. So the outer ear, it consists of the external satellite dish heads on either side, and the ear canal, what we call the external auditory meatus. We then have the middle ear, which is made up of the eardrum, also known as the tympanic membrane. Three tiny bones, and collectively they're known as the ossicles, but individually you may be more familiar with the terms the hammer bone, the anvil bone, and the stirrup bone. And we also have a tube, a narrow orifice called the eustachian tube, which connects the middle ear to the back of the nose. And the eustachian tube is almost like a drain pipe. It allows fluid that collects behind the eardrum to drain away, and it also helps to ventilate the space in the middle ear. We want air to be in there, and that's the function of the eustachian tube. Last but not least, we have the inner ear. The inner ear is composed of the organ of hearing called the cochlea, and it looks like a snail. In fact, the word cochlea translates in Latin as snail. We have the organ of balance. So the organ of balance that we call the vestibular system, it's composed of three what we call semicircular canals. You can just about see them top left of the inner ear. So on the blue border with the middle ear, there's three little rings there with all the nerves, the blue nerves attached. And finally, both the organ of hearing and the organ of balance have nerve endings, and these connect and conjoin and intertwine to create what we call the cochlear vestibular nerve, so the auditory nerve, the eighth cranial nerve, which goes to the brain. So just going back to the organ of hearing, the cochlea, which looks like a snail, that's full of fluid. There's actually two types of fluid, but the one that we're interested in today for today's talk is a fluid called endolymph, which is rich in potassium. And that will become a bit more evident why I've mentioned that now a bit later on. And also the cochlea is full of thousands of what we call sensory hair cells. And the cochlea is tonotopic. So what tonotopic means is different regions of the cochlea code for different frequencies of sounds. So high frequency sounds are detected and processed near the entrance of the cochlea. And on the diagram, I've annotated that HF. And that's near the entrance, the base of the cochlea. And as we go around the spiral, near the apex, the tip, that's where the low frequency sounds are detected and processed. So how does the outer, middle, and inner ear all connect? How does it all work as one system? Well, sounds are captured by the outer ear, the pinna. So I've labeled that number 1 on the diagram. So that's like the satellite dish. These sound waves are channeled through the ear canal, which I've annotated as number 2. They arrive at the eardrum, and when they hit the eardrum vibrates, and I've labeled that number 3. These vibrations are transmitted through the bones, the ossicles, which I've labeled 4. And as these vibrations are transmitted, these bones begin to move, a bit like a pendulum. It's just like a lever system. And the last bone, called the stirrup, and that is the smallest bone in the human body. The length is around 2 millimeters. That's connected to the organ of hearing. And when that stirrup bone moves backwards and forwards, it displaces all the fluid, all that fluid I was making reference to in my previous slide. The fluid then travels in waves. And these waves, known as a traveling wave, travels over the hair cells, and it causes these sensory hair cells to move sideways and deflect it to one side. When they deflect, there's little gates, little channels in the hair cells that open, and when these gates open in the hair cells, it allows an influx of potassium. So potassium is contained in that fluid, the endolymph, and potassium helps create an electrical signal to be created within the organ, within the hair cell. And this signal is then sent to the brain via the auditory nerve. So I've labeled that 7. And we process that in a region of the brain called the auditory cortex. For most people, the auditory cortex is on the left-hand side of your brain, the left hemisphere. And the brain translates these electrical signals as sound. So if you have an impediment, an abnormality in the outer and or the middle ear, so from sections 1 to 4, we call that a conductive hearing loss. So sound simply can't travel through the outer or middle ear. It could be due to earwax in the ear canal, so in the part of the ear I've labeled 2, or an ear infection. It could be that the eardrum, label 3, is infected, or it's perforated, or the bones, label 4, are stiff. So we call that a conductive loss. And typically a conductive loss can, in most cases, be rectified either by surgery or medication. If you have an issue with the inner ear, so either the organ of hearing, the cochlea, the snell, or the hearing nerve, which I've labeled 7, we term that a sensory neural hearing loss. And a sensory neural hearing loss is a permanent hearing loss. It's irreversible. And diabetes, unfortunately, can cause a sensory neural hearing loss. So how does a diabetes-induced hearing loss occur? What's the pathophysiology? So it's due to something called arteriosclerosis. So if you're diabetic, you typically have high glucose levels, what we call hypoglycemia, in your blood. And this excessive glucose levels in your blood can damage the inner lining of the arteries and blood vessels. And where it's damaged the inner lining of the arteries and blood vessels, you get a natural buildup of plaque. So plaque can consist of cholesterol, fatty tissues, insoluble lipids. In addition, high glucose levels can reduce the secretion and the amount of nitrous oxide in your blood. Nitrous oxide is very important because it's known as a vasodilator. It helps open up arteries and helps promote good blood flow. So both due to the plaque, buildup of plaque, and the inhibition of the secretion of nitrous oxide, arteriosclerosis leads to a narrowing of the artery or blood vessel. And if you look on the right-hand side of the screen, you've got image A of a normal artery and image B. So you can see the plaque buildup there. It's narrowed the artery. And when you have a narrow artery or blood vessel, that unfortunately increases blood pressure. It reduces the blood flow, and therefore there's less oxygen and nutrients available to different parts of the body. So arteriosclerosis is the same pathophysiology which leads to diabetic retinopathy. That's when the blood vessels to the back of the eye, the retina, are damaged and diseased, and it can cause impaired and blurred vision. And also it's the same pathophysiology as diabetic nephropathy. So the blood vessels that go to the kidney, they get diseased, they reduce blood flow, and you can get disease of the kidney. So arteriosclerosis, diabetes-induced hearing loss, can cause damage to both the cochlea, so the sensory part of the inner ear, and also the hearing nerve, the neural hearing loss. And we're going to discuss each of those now. So how does diabetes-induced hearing loss cause damage to the sensory part, the cochlea of the ear? So as I mentioned in my earlier slide, in response to sound, we have these sensory hair cells, and they deflect to one side when waves of fluid travel over them. You can think about it like a tree or a plant or a bush in the wind. The wind is pushing this tree to one side, so it does cause quite a lot of physical strain to the hair cells. And as these hair cells deflect to one side, these little gates, channels open, which allows potassium to enter the cell, which helps create an electrical signal. However, at the same time, although the hair cell produces an electrical signal, it also creates loads of unwanted buildup of toxins like free radicals and oxygen scavengers, and these are not good for hair cell health. And the ear wants to flush these out as soon as possible. If it doesn't, your hair cells can degenerate, and it can also damage the hair cells. It can cause permanent death. However, in order for the hair cell to replenish, recover, repair itself, it requires a constant flow of oxygen and nutrients. However, due to arteriosclerosis, you've got damaged and diseased blood vessels, your hair cells no longer receive this adequate supply of oxygen, oxygenated rich blood and nutrients that it requires. And as I mentioned, this can ultimately lead to hair cell degeneration, and even hair cell death. So on the right of the slide, you'll see picture A and picture B. Picture A is an image taken with an electron microscope of these hair cells. And this is in someone with normal hearing. And there's actually two types of hair cells. We have outer hair cells and inner hair cells. And in picture B below, we have an image of someone who's got quite severe to profound hearing loss due to damage to these hair cells. So you can see some of those hair cells are no longer existent, whilst others are still there, but they're of a different shape. They've become denatured. Also, as I mentioned earlier, potassium is extremely important in the hair cells. So when these hair cells deflect to one side, these little channels open, the potassium from the endolymph fluid in the cochlea enter, and that's what helps create the electrical signal. There's a part of the cochlea called the stria vascularis, and the stria vascularis is responsible for the continuous supply of potassium within the cochlea. And that stria vascularis, you can tell by the name vascularis, it itself has a lot of blood vessels going to this portion of the cochlea. And due to arteriosclerosis, there's the blood vessels that supply the blood to the stria vascularis die or become diseased. The stria vascularis shrinks, and it can no longer provide the adequate amount of potassium in the fluid in the cochlea, which the hair cells need to produce the electrical signal. So the combined effect, both to damage to the hair cell and the reduced amount of potassium in the cochlea, means there's less electrical signals created and sent to the brain, which results in a hearing loss. And typically, with diabetes-induced hearing loss, it's the high-frequency hair cells that become damaged. And that's because the high-frequency hair cells are located near the entrance of the cochlea, okay? The best way to analyze that is imagine the carpet in your hallway at home. The carpet near the front door always gets worn out quicker because people are constantly walking, treading over it. And similarly with the outer the hair cells for the high frequencies, because they're located near the entrance of the cochlea, they're more susceptible to undergo physical and chemical changes. Arteriosclerosis can also cause what we call diabetic neuropathy. In diabetic patients, they normally experience this in their feet or the legs. So diabetic neuropathy is damage to the nerves, but it can also damage the hearing nerve, the auditory nerve, the eighth cranial nerve, which sends messages from the cochlea to the brain. And it can do that in two ways. So if you look at the diagrams on the left, and if you focus on the top left diagram first, that is of a neuron, a nerve fiber. And so the main electrical signal is passed along the body of the nerve fiber from left to right, and we call that the axon. But coating this nerve fiber is something called a myelin sheath. So it's like an insulation layer. It's made up of fatty tissue. This is critical for two reasons. not only does it protect the main body of the nerve, the axon, where the signal is sent across, it also helps with the efficient transmission of the signal. And when you've got a reduced blood supply of oxygen and nutrients due to arteriosclerosis, so the damaged blood vessels, this myelin sheath denatures, it breaks down, it's no longer there. And this can cause a distorted signal. I have some patients that they've got, when you do a hearing test, they've got absolutely normal hearing. However, when they listen to speech, although they're getting the signals to the brain, they can't process the signals. Everything's garbled and muffled, and that's because they have a damaged myelin sheath. So the signal is still traveling through the nerve, but in a distorted manner. Everything becomes scrambled. When you've got the most common symptoms of hearing loss is reduced clarity of sounds, and that's because the high frequency sounds provide the clarity. People with hearing loss rely on their visual cues because they're not hearing so well. They also require visual information, so lip reading, which is hard in this present day and age because of the mask. Most people with hearing loss hear quite well in a one-to-one quiet situation, but they struggle more in background noise. People with hearing loss tend to increase the volume on the TV or radio. They also find it hard to localize sounds. They can hear a sound like an ambulance siren, but they don't know where it's coming from. People with hearing loss, because they're having to concentrate and focus a lot, they can get physical and mental fatigue. Also, if you're not hearing well, you can't partake in conversation, you lose your confidence, you may be answering incorrectly to what's being asked. And ultimately, that can lead to social withdrawal and emotional distress. Just some quick facts, which I think is important. So if you're diabetic and aged between the age of 19 and 69, you're twice as more likely to have a hearing loss compared to your non-diabetic counterparts. Even if you're borderline diabetic, so you're not yet diagnosed clinically as being diabetic, you're 1/3 more likely to have a hearing loss. And as I mentioned earlier, diabetes-induced hearing loss affects the high frequencies more. So 54% of people who are diabetic and have a hearing loss above the age of 60 have a high-frequency hearing loss compared to only 32% of hearing loss non-diabetics above that age. And the final slide is how to look after your ears. So prevention is better than cure. So please do manage your blood glucose levels, whether that's due to your diet, exercise, medication. Exercise is good because it helps circulate the blood across the body. We want the blood to go to the ears. If you've got a bit of extra weight, please do try and lose that, because excessive weight makes it harder for the heart to pump blood, especially to the periphery organs, so to your feet, to your fingers, to your ears and your eyes. Protect your ears, don't poke, don't use cotton buds, please don't get water in your ears, it can lead to an infection. Avoid loud sounds, protect your ears, they're so important. As diabetics, I would definitely recommend having regular annual hearing checks so you can detect any deterioration in your hearing. And early intervention is so important. If you do have a hearing loss, please do consider wearing hearing aids if that's what's been recommended. It helps avoid auditory deprivation. So if you do have a hearing loss and you don't wear hearing aids, these nerves from the ear to the brain, they become dormant, they lose their function, you won't hear as well. And also, there's a lot of research recently to suggest that untreated hearing loss is a big risk factor in developing cognitive problems such as dementia and Alzheimer's. And of course, hearing not only improves your hearing, it also improves your confidence and independence. So, I hope that was useful and informative.